Can you tell me a story, Dr. Panico, about a patient that you'd seen with gout and that you were either able to help them or help prevent the next attack? Tell us how this works in real life.
Yes, yes. So I have lots of stories to tell about gout. So I think it's, kind of twofold. And if I can talk about two different types of patients, because I think we get really excited about how our medications work, but then also we kind of have to think, okay, well, not everyone has severe uncontrolled gout, right? What happens to the patient who comes in the first, they have their first attack, their second attack, their third attack, then what? So recently, just this past week, I saw somebody who was referred by their podiatrist, and he comes in with a swollen foot. The top of his foot was swollen and obviously very hard to bear weight and struggling to go to work and things like that. And so he had not been on any medication. He was just using NSAIDs or ibuprofen, basically, to treat the pain. And so we talked about our options. We got some blood work basically to assess where his uric acid level is, and then decided to start allopurinol. So that's our most basic oral medication that lowers uric acid in the body. And then we adjust the dose based on his level. So I tend to be a little more aggressive with my patients and try to get their uric acid level fairly low. And I think that really helps prevent them from having those intermittent flares kind of when they're stable on treatment. So we talk about my approach and talk about, our goal to really drive that uric acid level down in his body and adjust medication based on his level. So that's somebody that I recently just had that was actually very simple, right? He's on one medication basically, and then intermittently we use other things to help with the flares and the pain. And then my other sort of example on the opposite side of the spectrum are really severe, what we call tophaceous gout patients who have knobby sort of masses or lumps that you can see under the skin. A lot of times they happen on the elbows. Sometimes your fingers may, be hard to bend, or really arthritis, right? Like it mimics rheumatoid arthritis oftentimes. So this patient actually came in, he lives in Alaska, and so was flying down to visit some family, and his family said, you got to get in to see somebody about this, because he was having a really hard time gripping and twisting. And just looking at his joints, he just looked like really severe osteoarthritis. He had really knobby knuckles, but wasn't really moving his hands. So we kind of talked, examining the patient is so important because of the way the joints and the skin looks. And so just looking, doing an exam, talking to him about his history. Of course, he reported a history of having gout flares, but didn't necessarily think it was that big of a deal. And so come to find out, he has like very aggressive gout that's causing a lot of damage in his hands. And so through imaging, blood work, everything, we determined to start him on the IV medication called Krystexxa that basically rapidly flushes uric acid out of the body. And so he's, somebody on the opposite end of the spectrum where you're going along and maybe you see somebody and they say, oh, it looks like you just have osteoarthritis or even rheumatoid arthritis, and start down that path. So both of these examples are somebody who's just starting out in the gout journey, and then somebody who's had gout for many, many years and sort of loses sight of what those flares are because they're maybe not top of mind or don't happen as often or as painful. But the message really is that uric acid is depositing all that time. It's accumulating and causing damage. So it does warrant treatment, even if you're not in pain all the time. And our patients, I think we really find once we treat them, their pain that they're living with gets so much better. The stiffness that you think you just have to deal with, right? The trouble gripping and moving your hands that just you tell yourself, well, I'm just getting older. I just have arthritis. That can get so much better.
Well, thank you. I really like the fact that you were able to provide us with two extremes, right? So number one patient, was easily treated with allopurinol, got symptoms under control, and able to prevent the progression of that patient to example number 2, where we have so much, it's almost like the gout has run out of space, and now you have tophi and you have lumps, and those lumps are damaging the joints. And I think the most important thing that Dr. Panico mentioned is that even when you're not having pain, the uric acid is still accumulating and it's still causing damage. So that's the thing about gout, is that you do need to treat it. And like, unlike the first patient who got treated early, is able to actually prevent the progression to the other patient who's an extreme case just because there's been so much damage. But the other thing that Dr. Panico mentioned is that there is a medication that's intravenous, and it actually melts away the gout crystals. And so that, in the world of rheumatologists, that is one of the most exciting things in our world. And so I think that's part of what the fact that we can do something to help patients makes a huge difference in their quality of life and their joint preservation. So thank you. I think this will really, thank you for that. Actually, I wasn't expecting to, but it really makes a difference to be able to differentiate between the two of them. Thank you.